community-based care department provides palliative care to 1,400 clients living with HIV and AIDS.
Collaborate with the community, assisting them to get clients to the center, and we also mobilize the community to take care of their patients while at home. We also have a social arm of the department, whereby we've got the 2 social workers who go out to assess the situation on the ground, and if the clients require some assistance that we are able to provide, then it is accorded to them after the assessment. We also have a nutritional arm. Being a department that deals with HIV and AIDS, we also put a lot of emphasis on nutrition, so that they go hand in hand with the medication that we give to these clients. So we've got a nutrition officer who goes out to the clients' homes, advising them on better nutritional practices, so that some of the drugs that they use could interact with the medications. So she advises them appropriately on what kind of foods to use, and also to use locally available foods that is accessible and affordable to them.
We actually encourage that all our clients come through the nutrition desk, simply because nutrition and the use of medication in our setting, especially as part of the care and treatment of HIV and AIDS, nutrition is very important. For the medication to work, good nutrition is so vital, because they work hand in hand. When a client practices good nutrition and adheres to the medication, then the quality of life is improved.
We've also got, under the clinic, we've got a pharmacy, and we've got a pharmacist who, in liaison with the clinicians and nurses, would advise us appropriately on what drugs to give clients or to start clients on, and also advises the clients on what to use. If it interacts with food or other drugs, she's able to elaborate.
Like for the opportunistic infections, drug we buy them from the meds, and for the ARVs we get them from the district hospital.
They also provide continuous trainings to people living with HIV and AIDS on basic management of HIV illnesses. They also provide adherence counseling to more than 200 people living with HIV and AIDS, as well as conducting adherence follow-up home visits. The Orphans and Vulnerable Children Department provides care and support to 3,600 orphans and vulnerable children.
We do our activities in 4 areas. We have 4 subsections. That is Family of God, that normally deals with those children who are from the street or who are living in the streets. And we also have TCTC, it's a Transitional and Care Training Center, that deals with children who are HIV positive and their situations are not all that okay in terms of nutrition, their health. But the way TCTC works, they normally get the referrals from the field. And again, apart from having TCTC receiving referrals from the field, they also receive referrals from our heart clinic. But the heart clinic, we have a social worker there who works at Kericho District Hospital, who refers again the issues to TCTC and also to the field workers, so that they do the home visits and do the home follow-ups.
The boy that we enrolled here is known as Elikana. At first he had a heart problem, and we took him to Eldoret, and then the heart recovered by miracles. And then later we bring him here. We usually visited him and provide nutrition, beans, maize, and they stay with their father. And the father is a drunkard man. So the condition now it's not bad. The boys are now have recovered.
The Program Development Department aims at providing sustainability to Live with Hope Center.
The idea of PPD is that the project Live with Hope will become self-sustainable in the long term. Not only the project itself, but the beneficiaries which we serve here. In light of this, we decided to set up an income-generating department which would help us in our long-term vision towards self-sustainability. However, when we're any program that we become involved in, we say that it has to be guided by two principles. One, in that it has to be cost effective, and the second thing, that we have social empowerment. Initially what we did was we started a kosher mill, which was sifted grade 1, and it had been working 24 hours round the clock. At the moment, this is one of our projects, which is t-shirts, where we have a jewellery workshop. You can see some of the jewellery that we've made, and we're also doing soap. It's just a small space, and it's just to show people that with the recycled plastic that we could set up a little greenhouse. Last year we had a very big yield from this, and some days Joseph was able to take home 480 shillings. Now what we've also did is that we would grow the seedlings in here, and then we're able to supply the seedlings to the community and the clients from here.
The Counseling and Testing Department, commonly known as HIV Counseling and Testing, targets 10,000 individuals within our coverage area to be counselled and tested.
VCT department, we offer some programs that is standalone. We have also the mobile VCT that is during moonlight and also during the day.
It's a moonlight VCT. We are normally doing it at night, since people have stigma of maybe attending VCT during the day. So they have a chance of being tested during the evening hours, because maybe most of them are from job, they have come home to rest, and they can have a chance of being tested.
And there is also another program that we normally call LWHC, whereby we go out and test the people, the family.
Support group at Live with Hope started in the year 2002. It's a group of people who are living with HIV/AIDS. They've been tested, they're positive. But they come together every Wednesday to have a meeting together to share. They do counseling, sharing how to live positive with the HIV virus. In the morning they start with a prayer which involved Holy Mass with the priest of the parish. After that, they have a counseling section among themselves. After that, they go ahead into groups where they involve themselves in various activities such as weaving, making different beads work. Also, some of them print t-shirts. They do all sorts of work to help them in income generation. And also, the support group taking members who attend clinic at Live with Hope and who are willing to join them and to be punctual in attending the meetings on Wednesday. It's also good to note that members of the support group are also our community health workers who go to the field visiting clients who are HIV positive. At the same time, they offer palliative care, especially for those who are dying, who are at the end stage of the HIV disease. They clean them, cook meals for them, give them drugs, provide food that they take obviously from the center, and make sure that the patients have enough love and also they die in dignity, knowing that somebody cares for them.
So in the support group, it's mainly to support one another. If you find somebody is down, if you find somebody discouraged, when you join the support group, you just become strong, because when you share, you see, when they normally say that when you share your problem is half solved. But when you keep it to yourself, it can bring a lot of stress to you. They normally teach us that stress normally kills. So in the support group, everybody knows his or her own status, and we are free about it, and there's nobody who gossips there, because we are all in one school, and we share our problems, and we love one another at the support group.
So over the years, Live with Hope has grown enormously, thanks to the goodness of so many people, but particularly PEPFAR, that's President's Emergency Plan for AIDS Relief, and that's a government agency rather that has channeled the money of the taxpayer towards helping projects in Africa, and we are lucky enough to be sponsored by them, funded by them. The way we receive our funding is through a group called Walter Reed in Kericho, and we are monitored by them. But we also have so many other donors. We are blessed to have great friends in Scotland, Ireland, England, and even in Kenya itself, who have helped us financially, morally and spiritually by their prayers. So we are so grateful for all of that help. Another relatively new project we are involved in is the Little Angels support group for disabled children, physically disabled, and we are trying to find funds for that to provide physiotherapy, a support group, transport to support groups, and other medical aids like wheelchairs and so on for those children. And we have been helped in this venture by the local primary schools.